and when you just first start using a aerotol, that too like in a like something that which is moving so fast in a kid, you need to have that stability in your hand, everything. You have to have that mindset also for it. Because that's when the first two teeth are up. So that time, in fact, many parents don't even know this. There are finger brushes which are available, so they can just fit it on their finger and you brush the teeth.
Okay.
That was the time when I'm holding and that guy is hitting my hand, like leave it. Then luckily the photographer looked at me, told me to look here, and he just died. And then I was just
They distracted you and just pushed you.
Yeah, it's like how I do. I distract children and give the injection.
Karma.
Yeah, karma. On the way, I actually didn't know whether they'll allow me to do the course or not also, because I learned swimming in a 3-foot pool, and then I was going into the ocean. So, and when I saw the ocean, I was like, oh no, we are going in there.
Hi everyone, welcome to the MADtherapy Sessions podcast. In today's 13th episode, we have Dr. Komal Nanavati. Dr. Komal is a consultant pediatric dentist in Mumbai. She is the founder of Tiny Tooth Tales and is a certified scuba diver. Komal, why pediatric dentistry?
So honestly, pediatric dentistry was not something that I was very sure, okay, I want to only do this. I liked ortho also.
Okay.
Ortho was something that I was keen on and from my BDS days. But then I worked for a few years, and then when I actually went in for NEET and I got pedo, I was very happy with it. It was good. It was a very good experience. I had selected ortho, but I had a pros and cons list actually, where
you mean actual list?
Yeah, actual list. So where I saw, okay, theek hai, here, if I want to change the direction of my career, technically any ortho case lasts for a year and a half. If I decide, okay, I want to stop consulting, I want to start my clinic, then you cannot really do that, because that much, probably you can.
Ortho is more about consulting.
Yeah, I mean, ortho is more about consulting, plus it's a long-term thing. Here I come for a case, I finish the case, and I'm back home. I'm done within a day or two.
Yeah.
That is for a year, 1.5 years.
So you wanted to quicker results?
Yeah, not really, but yeah, I mean, those pros and cons. Basically, I had thought of a lot of things, and plus, obviously, again, availability wise also and all. And I like general dentistry. I like root canals, crowns, everything. So, ortho, then 3 years you're concentrating on only that one thing. So, comparatively.
So, how has been your experience as a pediatric dentist?
It's very good. I was very glad I took up MDS. I was very glad that I actually decided to go further and do this.
Do that, yeah.
Yeah. I mean, something which I am very happy about. It's a degree which will last for a lifetime.
And what's the best thing about pediatric dentistry?
The best thing is that, so honestly, you're dealing with a child. You are dealing with someone who is really not new to this field. They don't have any preconceived. Obviously, they are anxious, but they don't have those fears. And also, when you're developing a dental routine or a dental hygiene for them, you're developing something for a lifetime that they are going to carry. Supposing a child from 5 years or 6 years of age knows that I have to take care of my teeth, they are going to take care of it forever. It's not going to be something that, okay, haan, theek hai, abhi. That way. So that is...
And generally people take, they complete their BDS and they immediately go for postgrad. You, on the other hand, took a 3 years break?
3 years break.
And then you jumped into doing masters, yeah. So, I mean, any particular reason, and how did you, what was the experience like,
So, when I finished my BDS, actually, I was quite I want to do something for sure. I always wanted to do some course or do something. I was sure I will go for a course. I will do something further.
Okay.
So I searched, I was researching, I was looking up for courses abroad. I was actually more focused on abroad. So I was looking up for some degree abroad or something. That's how actually we also met, because I went to Smilecare to meet Dr. Patil.
True.
So then
what put you off from going abroad? You decided not to do that?
Because I was looking at courses, so either those courses were something that would direct my life completely abroad, or they were really short. So it was not something like MDS where you get like a proper overall thing, and then I can come back and start. And plus, with around that time, I gained experience also. So I worked with Dr. Patil. I was managing a clinic independently for like almost 5 years. So yeah, I mean that really helped me get an insight ke theek hai, if I am settling in India, then I might as well do MDS, which is a very good degree in India, so why not? And
So, does it make a difference that you do BDS, then you take a gap, and then you do masters, or you will? I mean, after doing that, taking a gap and then doing MDS, or would you rather suggest someone to do
No,
MDS right away after doing the BDS?
I would definitely suggest take a gap,
And why is
probably
that?
not 3 years, like a year or two, because as a BDS we are not as exposed to the various fields. Once you, and plus you're more into studying. The 1 year of internship does not give you as much exposure as it should. Like when you and the practice that we do in college is very different from private practice. So, if you have an idea of everything, then, and plus you work for a year or probably 1-2 years or something, you know what you like in the field, because it's a vast field.
Yeah.
You can probably like placing just implants. Then you go for prostho or OS or whatever. If you like general dentistry or you like endo, then you can go for endo. But you need to understand what you like and then jump into it. Abhi, what happens after BDS, you will probably jump into availability wise fields. So that way it's better to work, know what you like and then go.
And was pediatrics your favorite subject or posting during your BDS days, or it was something else?
It was. Endo was actually my complete favorite.
Okay, and why is that?
Because one way, again, endo, you do a lot of work. From probably third year, class 1, then class 2, composite restorations, root canals, everything.
Root canals, yeah.
So you do a lot of work basically. So I used to like clinical practice. So I used to enjoy endo as this thing. Even the professors in my endo department were very nice, very encouraging with work and everything. So it was good. I enjoyed over there. Pedo I liked, but pedo actually more or less you do basic work.
Yeah.
And pedo is something where probably as a BDS, you are not that well oriented in child management and everything. So, and and when you just first start using a aerotol, that too in a something which is moving so fast in a kid, you need to have that stability in your hand and everything. You have to have that mindset also for it. So yeah, I mean it makes a difference.
Makes sense, yeah. And what's one like and one dislike about pediatric dentistry?
So I enjoy working with kids. The innocence that the kids have, you talk about anything, you distract them, they get distracted. If they've had a painful treatment or you have to inject them, they're upset about it or something. So what happens is after that, once they are done, it's forgotten. They are very forgive and forget.
Okay, the kids.
Yeah, definitely. And it's fun. In today's world, the kids are so smart. I'm learning something from them every time that I meet them. So yeah, I enjoy it.
That's what you like, and what's one thing you dislike about pediatric dentistry?
Dislike. Actually, I dislike the fact that kids can't make their own decisions.
Okay.
So on the basis that many parents that I meet, they think कि अभी root canal करने की क्या ज़रूरत है, because it's a milk tooth, वो तो गिरने वाला है. The thing is that is going to, that there is a relevance to it, which is why it's there in the mouth. It's in place because of a reason. So if you're deciding for the kid, when the kid cannot decide for himself, he is going to last with your decision for the rest of his life. Because you removed the tooth, maybe the teeth didn't come in proper orientation, they didn't come in a place which they had to come in, there was no space left. And then they had to undergo ortho, then they had to undergo, so much that the kid has to face because of the parents' decisions, and that they never took for themselves. So that is...
A lot of things in life, the kids have to suffer because of their parents, yeah. But then, there's one thing which I wanted to ask you is because, in college, we used to never call it pediatric dentistry. We used to always call it as pedo.
Yeah.
like pedodontics, and like where's your posting pedo? Who's your dentist? Like a pedodontist, like, you know. But then as you, like, you know, as life progressed, you understood that it's a very controversial word, like the word pedo. So what's your take on that?
So honestly, I had not thought of this. Like, it had never occurred to me, because when we enter the dental fraternity, like, you know, pedo becomes such a normal word. Like,
Yeah.
you say, pedo posting hai, this and that. But when I actually took up my MDS, this one incident hit me, and I realized, oh God, I have to say pediatric dentistry. I cannot just say
Yeah.
pedo to the outside world. Because dentists will understand it. The outside world was like, so a friend of mine, she's a dentist, but her husband is not a dentist. So
Okay.
he asked me, oh, so you got into MDS with specialty and everything, and I was like, yeah, I took up pedo. So he's staring at me for 5 minutes, and I was like, yeah, I'm doing pedo, and he's just like, what?
Yeah, doing pedo.
Yeah, and then it was just stark reality in face.
So did you explain it to him? Like,
Yeah, but obviously still, you know, that
Yeah.
he has that weird...
so if a parent has a newborn, what would your suggestion to them be?
So actually, parents nowadays are very aware. They are. I'm actually very glad, because most of the parents, you know, they know like pediatric dentist is a thing, and like getting your child for regular checkups is also a thing. They know about fluoride, which is also very good, because earlier it was not the case. Now it's times are changing, like with social media and everything, marketing, it's working well. But the thing is that they should come in at 6 months. That is the earliest that they should come in.
Yeah, because I was going to ask you that. What is the ideal age for
So
the first dental appointment for a newborn?
Ideally, textbook version wise and like, you know, guidelines wise, they tell you, okay, they should come like, you know, between 1 month, 0 to 1 month. In fact.
That early?
Yeah, because what happens is the child's feeding practices have started. So even if there are no teeth, you have to clean the mouth.
Mm-hmm.
And mostly the pediatrician will tell the parent that, you know, you use a muslin cloth or something. But more or less, many parents kind of like, sometimes, you know, the child goes to sleep like right after having milk and everything, and then if you go to clean the mouth, the child will wake up crying again. Parents are already harrowed in the first few months. So that, but if you set a practice that early and the child is used to something in the mouth, like, you know, like a cleanup after a feed or after having food, so then when the teeth progress, the child will set into it very easily. Even with 2 teeth, he'll let you clean the mouth. They will not be fussy.
Okay.
So these small things, you know, if they are set into practice early stage, it works very well throughout.
So ideally it should be
6 months is ideal,
6
because
months.
that's when the first 2 teeth are up. So that time, like, you know, in fact, many parents don't even know this. There are finger brushes which are available, so they can just fit it on their finger and you brush the teeth.
Okay. And they can start that as early as, the finger brushes?
6 months.
6 months. Okay.
You don't need to introduce a toothpaste. You can just, because the child is not really eating solid food, but like just to clean the milk around the teeth.
And another, not a controversial thing, but just wanted to ask, is fluoride, good for kids? That's a question which a lot of people ask. And
So fluoride is actually a double-edged sword. Like, we even learn it that way. So it mainly depends. There are so many guidelines which are constantly changing. Earlier they would say for children less than 3-year-old, like, no fluoride. Now they are saying you can give rice-size amount of toothpaste to them, which is fluoridated, but because it's good for them. So fluoride has a very good thing. Like, it is anti-cavity effect.
Yeah.
But if ingested, it will cause a lot of problems at a certain amount more than required. So all in all, what I have come to it and what I recommend is that once the child can spit out,
okay,
when they reach that age where they can spit out, you introduce them to completely normal toothpaste, which, you know, has fluoride, and you can start a normal regimen. But till then, you use something which has lesser amount of fluoride. You can come into a dentist, they can apply a varnish, which is safer than using a regular toothpaste, because the child is going to gulp it in. That is going to be harmful. So rather than that, you come in, we do a fluoride, which is 6 monthly fluoride application, which is safer.
Okay.
Which is supervised rather than, doing it that way.
But it is important for the
It is definitely important.
And what are the weird things you have witnessed as a pediatric dentist? Like
Oh, very many things.
anyone?
So there was this parent who had applied nail paint on a child's tooth.
Like nail paint.
Yeah, nail paint. It was very this thing innovative because we apply varnish,
Yeah.
to reduce sensitivity. So I don't know how she thought of it or what concept she had in her mind, but like literally proper nail paint she applied on her tooth, saying कि सोता नहीं है रात को and all of that, तो दुखता है
So
उसको.
she put a nail paint on the tooth.
Yeah, she like covered it with the nail paint.
Which color was that?
It was red. I thought it was bleeding first time I'm looking at it. She's like, नहीं nail paint लगा है, and I was just staring at her. What have you done?
She herself applied.
Yeah, she applied
I
nail
mean,
paint.
smart in a way, but then like
Chemicals are
exactly
terrible,
not. Which is you can't recommend that. Yeah.
Yeah, 4-year-old child taking in nail paint in the mouth. We are not allowing fluoride in the mouth, then she's putting nail paint.
Like any memorable experiences you want to share with us as a pediodontist or during your BDS days or anything like that?
Memorable during my MDS actually. There was this one. It's a very sweet experience. So there was this special child who was there. So he was like little mentally retarded, and he had come in for a treatment. He had to get an extraction done. So obviously now he will not understand. He couldn't speak, nor could he. He had a lot of problems. So even behavior management was a little difficult. We had to like hold him, and we had to get things done that way. So it was very sweet because he was always smiling. Through the treatment, obviously he cried a little bit during the injection and everything. But other than that, he was fine. Then later he settled down. We had kept him under observation. So we told the parent to wait an hour just to see how it goes and everything. During that time, another patient was undergoing extraction. So we were removing the tooth and that child was crying very badly. So he comes in. He goes to her and he like literally pats her, and we had given him like a toy.
Okay.
He literally gives it to her. Imagine, and this child does not have the capacity of a normal child, and him doing it really touched me. So children inherently are also like really innocent and sweet, which is a very cute, very sweet.
Yeah, a very sweet experience, truly. What things should a parent consider when they're buying a toothbrush or a toothpaste for their kids? Because that's one thing which I get asked a lot, and I thought I would ask a specialist.
Yeah, so honestly, if you go to see, very truthfully, almost all toothbrushes and toothpaste, apart from the marketing gimmicks, have something very similar in their configuration. What I usually tell the parents, or I would usually recommend, is that the function of brushing, like the way you are brushing the child's tooth, is more important. Obviously, the toothbrush and toothpaste are important. I would suggest electrical toothbrushes because that improves the function.
Yeah.
I mean, children don't develop a manual dexterity that we own till a certain age. So, and if the parent is not going to supervise, parental supervision I find is very important till at least the age of 6-7. And if that is not going to occur, then electric toothbrush is a better option. And now so they have those fun brushes where the kids will enjoy.
They have Marvel toothbrushes, Batman, Superman, yeah.
Colgate also has those Batman, Superman. So those whatever, but electric would be a preferable option, and supervision. And toothpaste wise, I as such something which is low fluoride till 3 to 6 years.
Okay.
They have half the ppm, and then after 6 years they can start with the general adult fluoride toothpaste. And Chico is a very good brand which I usually recommend because it has xylitol. It does not have normal sugar. So xylitol is an artificial sugar, but it has been seen to cause less cavities in children.
Okay. That's great. Do you plan to open that's a personal question from my side. Do you plan to open your own clinic anytime soon?
Not soon.
And if yes, what are the reasons?
Definitely.
Why do you feel the need to open a clinic?
So I've worked with doctors. I've managed a clinic on my own also individually.
Yeah.
I have worked as a student also. So with all of those experiences, I like the idea where you can. I enjoyed the doctors I worked with definitely, but I like the idea of having your own practice, your own place, where you take all your decisions, where you know what you want to do. You can set up your own protocols. So yeah, I mean.
But like you said, you have that kind of experience, like, you know.
Yeah.
So ideally, people should get that before opening their own practice. They should work somewhere. I mean, know how a clinic functions, but because that's, I mean, very different than what is being taught in colleges. Like, you know, you actually get a shock when you go outside college and, like, you know, start working under someone and you're like, we didn't do this in college, like, you know.
We faced that together.
Yeah, exactly. I mean, that's the thing, like, you know. But it's great to know that, like, you plan to open one soon. Also, you are like an adventure enthusiast. So, can you share something about that?
Honestly, I've not done so much adventure, but yeah, I mean, I have done a tandem skydive, which was fun till you actually
you do a lot of scuba diving also. Like, I've seen like a lot of.
Yeah, I learned scuba diving.
Okay.
I got certified into scuba, which was a very last minute thing. So 1 month before we decided, my friends were doing this course and I decided, yeah, okay, I'll do it. I was actually a non-swimmer. I didn't even know swimming.
Okay.
And suddenly I'm becoming certified scuba diver. But yeah, so what happened was, like, we decided, okay, we'll do this course. Then I come to know you need to know swimming.
Yeah.
And I was like, okay, and pandemic situation, no pools are open. Then a friend of mine very sweetly told me, okay, we can learn in my building.
Yeah.
So both of us looked for an instructor, searched. We called him. Then, like, for 10 to 12 days, every day in the morning I was learning swimming. And then finally I was like, okay, we are going.
Yeah.
We're doing this. On the way, I actually didn't know whether they'll allow me to do the course or not also, because I learned swimming in a 3-foot pool and then I was going into the ocean. So, and when I saw the ocean, I was like, oh no, we are going in there.
That's a very good example, working in a college and then working in a clinic.
Yeah.
It's like a shock, like going from a swimming pool to a...
Yeah, to the ocean. And this is vast.
Yeah.
What was I thinking?
But, like, you know, I mean, how did you feel?
It was amazing.
Okay.
Like the Zindagi Na Milegi Dobara feels. No, but truthfully, it was damn good. Like, so you don't really need to know so much swimming, but you should be comfortable in water. Okay. And for the certification, they have a test where they see whether, you swim 200 meters and snorkel and all of that. So they check all of that. Apart from that, when you are inside the water, you basically have to be underwater. You don't really do anything, and you have that equipment and everything. Then, but like, the course was rigorous. Like, we were waking up at 5 in the morning.
Where did you do it?
Andaman.
Okay.
So over there, mornings are very early. Like, sunrise is at 5. So we are waking up at 5 in the morning, going for like a 1 hour scuba. But before that, the whole prep of it. And then sometimes it's in shallow water. So it's a 3-hour thing. Like, you're in the water for like 2-3 hours. You're doing skills where they make you remove your face mask. And, like, they fill water inside. So in case sometimes if it gets loose and water fills in, what will you do? How will you...
Makes sense, yeah.
Yeah. So they teach you a lot of things.
And skydiving also, right?
Yeah, skydiving.
Was it like a personal thing you always wanted to do, or was it like a last minute thing?
So I never, when I went to Dubai, it was more like a family trip and everything. So it was not like there was anyone else with me. It was just, and I had seen the Skydive Dubai thing and I had seen like the Palm Jumeirah. It just called out to me and I thought, why not? And but I had always left it open. I was like, agar time mila to I'll do it, otherwise no. But it took a lot of courage because there was absolutely no one with me doing this. My parents were like, waiting ahead and they were like, oh, is that her? Kind of a thing. And I'm alone and they give you that form.
Not scared of heights?
Not very much. But obviously when you're looking out of that helicopter and you're seeing I have to fall, then obviously that hits you hard. That was the time when I'm holding and that guy is hitting my hand, like, leave it. Then luckily the photographer looked at me, told me to look here and he just died, and then I was just
They
out.
distracted you and just pushed you.
Yeah, it's like how I do. I distract children and give the injection.
Karma.
Yeah, karma.
Also on that note, what's your favorite oral healthcare brand?
I don't really have a very favorite brand as such. Like Colgate, Oral-B are good. They are good with their marketing, so they are good. But yeah, I mean,
Something which you personally use and recommend to people.
personally, I use Colgate
Okay.
as of now, and I have because some.
Is it because it's the default option, or like heavily marketed and like since childhood, or any other reason, or you actually love the products?
No, I don't really love the product.
Okay.
It's something I've used throughout, and it's just probably habit.
Okay.
But yeah, and plus I think they are very competitive. Like they will introduce new things every few months. So like, and now obviously I can't go back to that normal with toothpaste without namak or toothpaste without anything, the bland toothpaste that we used to use. So now with that, because you're set to this routine that you wake up in the morning, there is a certain taste like you're waking up to with that toothpaste. So now it's set. So yeah.
And what's next for Dr. Komal?
Next, I definitely want to
Like
further.
coming years, anything?
I would love a second season. Why not? It's fun.
No, but like what's next for you professionally also?
So, yeah, I want to super specialize. I'm
Okay.
looking at courses. I'm looking at fellowship options. I'm looking at things which I want to do definitely, and even consulting, working, something that goes well hand in hand with both. And after a certain point of time, clinic.
But why do you feel the need to like again do like super specialization in your field?
I feel there is a lot in pediatric dentistry which you can further into also. Like it's a
Okay.
vast subject. Like just as a pediatric dentist, also you can still go further ahead. So there is so much that you can do. So why not? Like
Okay. And so one is PhDs. Have you thought about that?
yes, but not now for sure. Not in anytime soon. After a point,
5
if
years
it
again, like-
feels- yeah, but that is again correspondence, so it would not be very hectic or as it will not be something like MDS for sure, which was a beautiful journey, but still like I think now I want to still dive into more clinical practice and then let's see academics later.
Before we leave you, any one thing, any myth you want to destroy or burst about pediatric dentistry, which people have they have misconceptions about pediatric dentistry, or some any bias they have against periodontists or dental treatment for kids?
Yeah, so that basically this only that milk दूध का दांते गिर जाएगा and all of that only that it is important that it is in the oral cavity for a reason.
Okay.
You have to treat it, and the fact that many people and parents don't know that your permanent teeth are developing right below the milk teeth. So there is any infection in the milk teeth, it is directly going to affect the permanent tooth.
Okay.
So if you're going to take it lightly and say ठीक है मतलब ये तो गिरने वाला है, we don't want to get a root canal done or we don't want to remove it or whatever, it's going to directly affect on a long term basis. So
Even the nutrition gets hampered, right?
Yeah,
For the kids,
nutrition,
if they don't
definitely.
have proper teeth.
yeah, so if you're not like many doctors, many patients, parents don't want caps on the tooth. They say कि हाँ ठीक है root canal कर दिया ठीक है, why do you put a cap, because this tooth is going to come off. These innovations have occurred for a reason, like first of all those teeth are more fragile than the permanent teeth.
True.
So you need to protect them, and if you've gotten treatment done, you want the tooth to last, then you just might as well put a cap and save it for a longer period.
Okay, makes sense. Yeah.
So yeah.
Done. Thank you so much, Dr. Komal, for taking out time for this short episode.
Definitely.
I hope you liked it, and we'll see you again soon.
Enjoyed completely.
I think it was your first podcast ever.
Yeah, first ever.
Thank you for everything. We'll talk to you soon. Thank you, Pa.
Definitely.
Thank you.
Thank you. How was it?
Done.
How was it? Was I talking loud? I don't know. I
No,
could hear
like,
myself.
that will
loud.
come to later. During editing and post.
I could hear myself very loudly, so I was thinking, should I talk soft? But then I was like, if I talk soft, then what if it doesn't come well?
No. You have to